Hey everyone, Doug Adams here from the RunDNA Podcast, and excited to share a case study, one that just from clinical practice here at Omega Project had a really good opportunity to explore a lot of how we integrate biomechanics into pathology and understanding how somebody's injuries or surgeries might really play into how they're running and how we can use that knowledge and combine it with our understanding of what normal running mechanics should look like to get a really good idea of how we can help somebody continue to participate, even if they might have something that would often be thought of as a limitation from participating in such activities. So if you're following along with the podcast, I'm going to do my best to just explain everything, and I'll try to say the numbers. But I really do recommend you go over to our YouTube channel to see the video, to be able to see it here. We've got the 3D file up where you're going to be able to just follow along, which is a great teaching tool. Talk about how to understand some of these things. So a little background on the runner. The runner is actually Triathlete and had some pretty involved left ankle surgeries. Definitely some things that are more fixed deformities that we know we're not going to get things like adequate ankle dorsiflexion motion. We know that we're going to be limited in some of the strength, and there's a lot of things, but this person has participated in Ironman events and has done some significant long distance running, as a frequent flyer here at Omega Project, but he really has invested in keeping himself healthy and in continuing to participate in the sports that he loves, and give him a lot of credit that he works really hard to make sure that he is able to participate and control that risk-reward relationship with his running. So we had him in, and we're doing a gait analysis with him, and I'm going to share a little bit of what we're seeing here with the gait analysis. So if you're watching, you're going to be able to just kind of see from different angles, kind of going all around here. But what you'll notice, one of the first things is his category, if you've taken our Certified Running Gait Analyst courses, is overstride knee drive. And a big reason for that is that he's doing a pretty good job of symmetry, considering. But the big exception to that is where he is landing for his right leg versus his left leg. So his right leg lands 32 centimeters in front of his body. And we can see on the screen here just kind of where that's happening and where he's landing in relationship to his body. And not bad. I would like that number to be 29 or less, admittedly. But when we look at the other side, he's on the left, he's landing 36 centimeters in front of the body. And we can see there's some differences there. And the knee drive part of it has to do with, if you're watching this here, you'll see the tracker markers that we use for the 3D. His ankle trackers look a little bit more like the back of an elliptical, and I really like those to look more like a teardrop. When it looks like the back of an elliptical, we kind of see that they're swinging their leg through like a pendulum, and this is going to come back to us here as we talk about what's going on with it. So again, just to reiterate, the left strike from center of mass is 36 centimeters in front of the body, and the right is 32. Now he's landing in a fairly neutral foot position here, 9 degrees in relationship to the ground of dorsiflexion on the left and 6 on the right. And the tibial inclination angle is a little high too, 6 on the left and 7 on the right. So that tibial inclination angle is the angle of the shin compared to vertical, and we want that close to 0 or more extended so that the shin is more upright while we're landing, so that we can absorb a lot of the forces throughout the lower kinetic chain there. So otherwise, looks pretty good. A little bit more internal rotation on this side. Not a lot of pelvic drop on the left side there. So again, if you're just kind of watching here online, you'll be able to just look, kind of observe and see. But overall, his form has really come a long way. And we've seen that he's made a lot of gains. And we have to ask ourselves at this point, can he handle changing his form? And what would the repercussions of changing his form be if we bring him back into a more forefoot type landing posture. It's going to put a lot of stress on the ankle. So maybe our goal isn't to necessarily get him to be all the way forefoot, but if we can improve some of that symmetry and get that 36 centimeter strike on the left closer to that 32 or 30 and keep him in a neutral foot position, I think that could really help out. Now, the trick is what cue do we use? And I think this is something we get asked most often after people take the courses, understanding why did you choose this course or why did you choose that cue with this person. And we do have one of our live skills lab coming up where we do a lot of practice with that, because I think it does take some reps, but as you learn it, you're able to really understand what you're looking for and how people respond to certain cues based off of their mechanics. So I'm going to get nerdy a little bit by looking at this. And knowing that this person has limited function at the ankle, and just looking at them run, you can kind of see just a stiffer ankle posture on that left ankle versus right. If you're looking at it, we're seeing some differences there. So if we just start off and look at some of the ankle position here, what we're going to notice is that this left ankle goes through less plantar flexion excursion as we get towards terminal stance and early swing phase. So if you're looking at the chart here, what we'll see is that there's a 0 line, and anything above this is ankle dorsiflexion, and anything below it is ankle plantar flexion. So if I highlight the orange one, which is the left ankle, you'll see that compared to the blue one, not going through nearly as much ankle plantar flexion. And what we can do is we can even pause this and go to a specific spot and look at it here. So, if we zoom in on what's happening here, we're going to see that's happening at that heel rise, just at terminal stance. We're seeing that not a lot of motion there. And then if we look and compare it to the right here, we're going to see that there is a significant more amount of ankle plantar flexion as we go through that heel off phase here. And we're noticing it's about a 5-degree difference on average there that we notice some of that. So that's interesting, but he's pretty symmetrical when you start to look at things like ground contact time. He's pretty symmetrical there. What we see is 260 milliseconds on the left and 259 milliseconds on the right. But what we notice a big difference is in this front side stance, where it's a 30%. So this is a number that looks at the percentage of time when your foot's on the ground spent in front of your body versus at the mid stage, or where your foot and hip are in line and behind the body. So we see it's 30% on the left and 22% on the right. So what we're noticing there is that he is landing out in front. So we have to start to ask ourselves why. So we know that there's going to be some limited ankle, but where else might this come into play? And if you match up what we see here, because he's going for symmetry and he wants to have these even steps, he goes into excessive hip extension on that left side by about 5 degrees. So what we're noticing is that he is, what we are expecting from Gait is that when we land, we are going through what's called the absorption phase. So as we are going, I'm going to hide these charts and kind of use this to explain here, but let's back off here. And as we look at this, as we land and the foot's coming into contact with the ground, for the first part of stance, we're absorbing force and our muscles are working eccentrically to absorb that. And then the second half of running is what we call propulsion phase. Now, the trick is that 95% of the energy that's absorbed in that first half can be returned almost passively in that second part where we are propulsion phase. Now, on his left, we've got a couple things that could be happening. We could see that he is not getting as much absorption and not getting as much generation. So he might be compensating and avoiding using the ankle. And we know that we rely on that big calf and that big Achilles tendon to really help return some of that function. And if he has inefficiencies and limitations in mobility there, he's not going to absorb as much force at the ankle joint, and he might not be able to generate as much force on the backside. So to compensate from this, and to go back to the charts here, we're seeing that he is on the ground for a longer time with going through further hip extension to get some of that symmetry. Now, one of the things that we know, though, is that now he's got the leg behind him, and we're seeing that he's not pushing off as much. But the push off and that ankle plantar flexion that occurs towards the end of running stance phase is something that we know also helps with swing limb advancement. So we're kind of seeing that he is getting the leg pretty far behind him, and that he's not progressing the swing limb as far forward. So therefore, he's going to have to pretty rapidly swing that leg forward to get back in symmetry, where he's pretty even left-right. He's going to have to swing the leg pretty quickly through. And that might be something that's contributing why there's some forward momentum and he's striking further in front of his body, is because that lack of push off and excessive hip extension that we're seeing is causing him to have to progress the leg quickly. So there's still some forward momentum that's causing him to land with his leg further in front of his body. So that's why a cue that we could try with this person is cueing him to get his foot off the ground a little quicker. Because we know that if we ask him, we don't want him to necessarily actively push off. A lot of that occurs passively. So we know also that he's limited in some of his ankle function. So asking him to do more work at the ankle might not be a good adaptation that we'd like him to do. So by engaging maybe the hip flexors a little bit more and doing a bit more of a knee drive and getting that foot off the ground a little bit sooner so it doesn't extend as far back, that might help him to go through more hip extension prior to his foot hitting the ground so that he's not striking as far out in front of the body. So that's why when we're selecting the cues, we have to think about what are we really looking to accomplish and where are our capabilities as well. So we want to look at what we could do for this particular person. So, that's a big part of what we want with him, but there's a lot more that we could also talk about with this person. So now that we kind of have his gait understanding, we have to start thinking about what should this look like and how can we institute some of these changes that we'd like, because we know he doesn't have full function of the ankle joints. We have to be a little careful about how we proceed. So with this, there were a couple things that we did. First, we looked at the loading levels, and we incorporated some of the loading levels to have an understanding of what can we get from a plyometric aspect from the ankle. And this might be very basic for somebody like this that has ankle limitations. We might start off with, I like an exercise called a depth squat, where somebody is not necessarily even leaving the ground, because that's going to put some more impact onto his ankle. And we want to avoid as much impact as he can because of the surgical changes that he has. So we might go through something where we're doing some rapid eccentrics, but his foot's never actually leaving the ground. And that depth squat is a real favorite of mine for this. So getting him started on some depth squats is probably one of the things we can work on from a movement capability. From a gait retraining standpoint, what we can do is incorporate some body weight support while we're doing some of the cues. Because especially if we are shifting some of that load to where he's going to absorb more in the posterior chain, by unloading him a bit, we're going to let him feel the movement that we're really looking for, but we're also going to unload that area and make it safe and effective for him. So whether you use something like the Lightspeed lift, the lever system, an Alter-G treadmill, a boost treadmill, there's lots of different options there. But getting somebody like this in there and doing their gait retraining in that environment where we're letting them be successful and understand what we're asking them to do, and then gradually adding some of the offloading back to get them back to normal full tissue absorption there, that's going to really make a big difference. So I think that's a comprehensive plan that we can do where we're doing some gait retraining. This is his off season. The triathlon season is ending. We're filming this in fall of 2024. So it's getting chillier, although it's warm here in Delaware for the next couple of days. But we're seeing it's time to start focusing on that off season and really what we can do to prepare our body for next season to make sure that our movement capabilities are maximized, but also our form and technique are reducing the demand on some of those movement capabilities. So this gives you an idea of how you might put together a gait retraining program for somebody. So if you're working with runners, trying to think about how are we going to get them the most success? How can we use the tools and technology around us to really help with that? And understanding that it doesn't have to be perfect. We're not trying to make this person have perfect form, but if we can make a small change for the next triathlon season, he might be able to get a little bit more volume in or have a little less pain. And that might make a big difference in his overall enjoyment and participation in the sport. So this hopefully gives you an idea and lets you know how we can use some of that biomechanical data when you're studying this. You have to understand how the body moves and what are the demands on it so that you can adapt what your training program is and your rehab programs are to make sure that somebody's getting a lot of success. So hope you enjoy this. If you want to dive more into some of the biomechanics, check out Certified Running Gait Analyst courses or Certified Walking Gait Analyst courses. Those are really important just to understand the baseline mechanics so that later, really expertise comes from knowing when to apply the basics. And if you understand a lot about gait and can understand what might be contributing to it, in this case, we looked at, we know the ankle is not going to be functioning as well. Where is he compensating and why is that leading to overstriding mechanics? Because we know that swing phase has a lot to do with some of the overstriding mechanics. We said, okay, reduce ankle function, verify it, saw that ankle plantar flexion was low, then say he's going to compensate at the hip, and that's going to contribute to some of the overstriding. Now, we also know that he doesn't actually have a lot of hip mobility. So another part of the plan could be either seeing if we can change the demand on the hip with the gait retraining, and if not, we might need to focus on some hip mobility as well, just knowing that that's his compensatory pattern. So I hope you enjoy this a quick kind of case talking about how we do some of the gait retraining. We talked about the courses. If you're a runner looking to get this, go to RunDNA.com and find a provider that is doing these types of gait analysis to help you. The off season is a great time to work on this, and we've got more to come about what you can do in the off season to maximize your gains. So thanks for listening. I hope you have happy and healthy running.
Like what you hear? Leave a review of the show wherever you listen, and don't forget to subscribe so you never miss an episode. RunDNA helps runners and running specialists through education and technology to identify each runner's unique injury profile to avoid setbacks and maximize results. The RunDNA Podcast is produced by Ace Running LLC. The RunDNA Podcast is intended for educational purposes only. No clinical decision-making should be based solely on one source. While care is taken to ensure accuracy, factual errors can occur. Always seek the guidance of qualified medical professionals before making healthcare decisions. Find us online at RunDNA.com.